Avoid ginger if you are prone to these 5 health issues. You probably think ginger is harmless, but in some cases it may quietly work against your body. We know that it sounds unbelievable. We're so used to calling it a superfood that we forget it may actually trigger serious health issues if you're not careful. In this video, we'll tell you exactly when ginger becomes a problem and why you should avoid it if you're prone to these 5 health issues. We're not saying ginger is bad for everyone, but you need to know when it's not safe for you. If you have any of the conditions I just talked about, please don't ignore them. Talk to your healthcare provider before making ginger a daily habit. Your body reacts in its own unique way, and sometimes what helps one person may harm another. Now, let's get started by discussing when people should avoid ginger. 1. Bleeding disorders. Most people don't realize that ginger may quietly thin your blood, and if you have a bleeding disorder, that may turn into a serious risk over time. One of the key ways ginger interacts with your body is by stopping platelets from doing their job. Platelets are tiny cell fragments that help your blood clot whenever there's an injury. But ginger contains a compound called gingerol, which interferes with how these platelets stick together. When that happens, even a small bruise or paper cut might take longer to heal. And if you were to experience internal bleeding, it could go unnoticed and become dangerous before you realize anything's wrong. On top of that, ginger acts a lot like a natural version of aspirin. It has salicylate-like compounds that further reduce clotting ability. While this may seem beneficial for heart health in general, it can be detrimental if you already have a history of bleeding. These blood thinning effects may not be obvious right away, but they build up quietly. If you're dealing with conditions like hemophilia or thrombocytopenia or are on blood thinners already, ginger may make things worse without warning. That's why it's important not to self-medicate with it and always talk to your doctor before using it regularly. According to research, ginger may increase bleeding risk by interfering with platelet aggregation. Lab studies show it may block clot-forming chemicals like thromboxane, which may be dangerous for people with low platelets or those on blood thinners. There's a lot more where that came from. Go ahead and hit the subscribe button so you're always in the loop with our latest health videos. 2. Gallstones or biliary obstruction. You might be surprised to hear that ginger, as healthy as it sounds, may actually make gallbladder problems worse if you're not careful. PubMed confirms that ginger is known to increase bile production, which helps your body break down fats. But if you have gallstones or any kind of bile duct blockage, that extra bile may push your system into overdrive. When bile flow increases, the gallbladder contracts harder to release it. If there's a stone already lodged or the ducts are narrowed, this pressure may trigger sharp pain, inflammation, or even cause the stone to get stuck in a more dangerous spot. That kind of blockage doesn't just hurt. It may lead to serious infections or emergency surgery. Because ginger can raise blood pressure, you should also be careful. This means it encourages the liver to make more bile than usual. For a healthy system, that's no big deal. But in someone already struggling with gallbladder issues, that extra workload may overwhelm the biliary system. It's like forcing traffic through a road that's already jammed. Things start backing up, swelling happens, and the liver or gallbladder may become irritated. So if you've had gallstones before or have any issues with bile flow, ginger isn't something you want to experiment with casually. Always check in with your doctor before using it as part of your daily routine. Now that we've hit the second health point, we'd love to hear your take. How does ginger play a role in your daily health? Let us know below. 3. Severe acid reflux or gastroesophageal reflux disease. It might sound strange, but ginger, often praised for easing digestion, may actually backfire if you struggle with severe acid reflux. One of the ways this happens is by relaxing the lower esophageal sphincter, or LES. That's the small muscular flap that keeps stomach acid from creeping up into your esophagus. When ginger loosens this muscle, acid has a clear path to move upward, causing that familiar burning sensation in your chest and throat. For someone already dealing with GERD, this extra acid movement may turn mild symptoms into full-blown flare-ups, sometimes even leading to inflammation or long-term damage to the esophageal lining. One more reason is that ginger is spicy and warm. It naturally stimulates gastric juices, including hydrochloric acid. That's great when your stomach needs help breaking down food, but not so great when there's already too much acid in play. This added stimulation may overwhelm your digestive system, triggering heartburn, sour burps, and even nighttime reflux. So while ginger may seem like a comforting herbal fix, it's not the best choice if your reflux is already severe. Always check with your doctor before relying on it, especially if acid control is part of your daily health routine. According to Science Direct, ginger caused mild side effects in functional dyspepsia patients, including bloating, heartburn, and diarrhea. 4. Low blood pressure. It might come as a shock, but ginger may actually make low blood pressure worse if you're already dealing with it. One of the ways it does that is by relaxing the muscles around your blood vessels. Ginger contains active compounds that act like natural vasodilators. They widen your blood vessels, which causes your blood to flow more freely. That sounds good in theory, but if your blood pressure is already low, this drop in resistance may cause your pressure to sink even further. That's when you might start feeling dizzy, lightheaded, or even faint, especially if you stand up too quickly or haven't eaten. Additionally, ginger makes it harder for the body to keep vascular tone. It may influence calcium channel activity and affect how your nerves communicate with your heart and blood vessels. This may reduce your body's ability to stabilize blood pressure when it drops. For people who already live with hypotension or get sudden dips in pressure, ginger adds an extra layer of unpredictability. That's why it's important not to assume every natural food is right for everyone. If low blood pressure is something you deal with, it's smart to talk to your doctor before including ginger in your diet regularly. According to ResearchGate, red ginger extract lowered blood pressure in elderly patients after 5 days. 5. Heart arrhythmias or use of antiarrhythmic medications. Here's something most people don't expect. Ginger might not be safe if you have a heart rhythm problem. One reason is its effect on the electrical signals that control your heartbeat. Ginger's active compounds, like gingerol and shogaol, may interact with ion channels in your heart cells. These channels regulate the flow of potassium and calcium, which are essential for maintaining a steady rhythm. When ginger alters that balance, it may make the heartbeat faster, slower, or more irregular, especially if you're already prone to arrhythmias. In some cases, it may even interfere with how your medications work, making them less effective or unpredictable. One more thing that worries people is how ginger affects your autonomic nervous system. This is the part of your body that manages your heart rate and blood pressure without you even realizing it. Ginger may overstimulate certain responses, leading to sudden shifts in how your heart beats. If your heart already struggles to keep a regular pace, this added stimulation may throw it off even more. That's why people with conditions like atrial fibrillation or ventricular arrhythmias, or those on antiarrhythmic drugs, should be extra careful. Just because something is natural doesn't mean it's safe for every heart. Always consult your cardiologist before using ginger if you've ever had trouble with your heart rhythm. According to ResearchGate, some herbal compounds with antiarrhythmic effects, including ginger, may interact dangerously with conventional heart medications. Now that we have discussed the problems of eating ginger for certain individuals, let's talk about the amazing health benefits of ginger. 1. Relieves nausea and motion sickness. You might be amazed to know that ginger is one of the most effective natural remedies for nausea and motion sickness, and it's backed by science, not just tradition. One of the main ways ginger works is by targeting the digestive system directly. When you consume ginger, its active compounds, like gingerol and shogaol, interact with receptors in your stomach and intestines. These compounds help calm the muscles in your gastrointestinal tract, which reduces the spasms and contractions that may trigger the feeling of nausea. This is especially helpful when you're dealing with motion sickness or that queasy stomach during travel, pregnancy, or post-surgery recovery. The ability of ginger to affect the central nervous system is another reason why it works so well. It interacts with serotonin receptors, which are responsible for signaling nausea. By blocking these receptors, ginger helps stop the vomiting reflex before it even begins. It's the same pathway that many anti-nausea medications target, but ginger does it in a gentler, more natural way without the sedative effects. That's why it's often recommended for people who can't tolerate heavy drugs or want a simple herbal fix. Just a small amount of fresh ginger, ginger tea, or even a supplement may make a noticeable difference when you're feeling off. According to Science Direct, ginger extract showed a significant reduction in motion sickness symptoms, with improvements in nausea, dizziness, and fatigue reported after use. Patients also showed better scores across multiple motion sickness domains, and most rated the treatment as well tolerated. 2. Reduces inflammation and joint pain. Most people don't realize that ginger works almost like a natural painkiller when it comes to inflammation and joint discomfort. One of the main reasons it's so effective is that it blocks the enzymes that trigger inflammation in your body. This is the same enzyme that medications like ibuprofen target. When ginger's bioactive compounds, especially gingerol, get into your system, they slow down these inflammatory pathways. That leads to less swelling, less stiffness, and better movement, especially in conditions like arthritis or chronic joint pain. It doesn't numb the pain. It actually helps calm the root cause of it. Ginger can also powerfully lower oxidative stress in your joints. Joint pain often comes from the buildup of free radicals, unstable molecules that damage your cells over time. Ginger helps stop this chain reaction by acting as a strong antioxidant. It neutralizes these free radicals before they can cause further inflammation or cartilage damage. This not only protects the joints you have, but may also slow down the progression of joint-related issues. When used regularly, either as a tea, supplement, or even in food, ginger may make your joints feel looser, less inflamed, and far more comfortable without relying heavily on medication. According to Science Direct, daily supplementation with 2 grams of ginger for 11 days helped reduce muscle pain after exercise by about 23 to 25% compared to placebo. Both raw and heat-treated ginger showed similar benefits, with no added advantage from heating. 3. Supports digestion and eases bloating. You'd be surprised how quickly ginger may settle an uneasy stomach and reduce that heavy, bloated feeling after meals. One of the key ways it supports digestion is by speeding up the movement of food through your stomach. When digestion slows down, food tends to sit in the stomach longer, leading to gas buildup and that uncomfortable bloated sensation. Ginger helps by stimulating gastric emptying, basically signaling your stomach to push food into the small intestine more efficiently. This action comes from its ability to activate digestive enzymes and improve muscle contractions in the digestive tract, making everything flow smoother and faster. Because it stops fermentation in the gut, ginger also works very well. When food lingers in the digestive system, it often ferments, creating gas that leads to bloating and cramping. Ginger helps break this cycle by lowering inflammation in the gut lining and improving the balance of gut bacteria. It calms intestinal irritation and helps your body absorb nutrients more efficiently, which cuts down on the byproducts that make you feel puffy and sluggish. Whether you sip it as tea or add it fresh to meals, ginger acts like a digestive reset, helping your system run cleaner and lighter without the need for over-the-counter meds. According to Science Direct, ginger shows promise in easing bowel disorders like inflammation, dyspepsia, and ulceration, especially in IBS and IBD patients. 4. Boosts immunity against infections. It's amazing how ginger may naturally fire up your immune system and help your body fight off infections. One of the biggest reasons is its ability to stimulate immune cells like macrophages and T cells. These are your body's first line of defense against viruses and bacteria. Ginger's active compounds, including gingerol and zingerone, boost the activity of these cells, helping them recognize and respond to threats more quickly. This means your immune system may act faster and stronger, especially when you're exposed to common colds, seasonal flu, or even more serious infections. It's not about masking symptoms. It's about training your body to fight smarter from the inside out. Ginger also makes your immune system stronger by reducing inflammation, which weakens it. Chronic inflammation puts your immune system under constant stress, making it less effective when real pathogens show up. Ginger helps break this pattern by blocking inflammatory messengers like cytokines and prostaglandins. That gives your immune cells a clearer signal and less background noise to deal with, so they may focus fully on destroying harmful microbes. When you include ginger regularly, whether it's in your meals, teas, or supplements, you're not just warming up your body. You're also giving your immune system a steady, natural advantage to stay ahead of infections. According to Science Direct, ginger extract improved immune function in non-smokers, which may enhance the body's antibody response against infections. 5. Improves blood sugar regulation. What most people don't know is that ginger may actually help your body manage blood sugar more efficiently, especially if you're dealing with insulin resistance or early signs of type 2 diabetes. One of the main ways it does this is by improving insulin sensitivity. Ginger contains compounds like gingerol that help your cells respond better to insulin, the hormone that moves sugar out of your bloodstream and into your cells for energy. When your cells are more responsive, less insulin is needed, and your blood sugar doesn't spike as easily after meals. This makes a huge difference in preventing those sudden crashes or sugar highs that leave you feeling drained. Ginger also has a strong effect on digestion by slowing down the absorption of carbs. It inhibits certain enzymes involved in breaking down starches into glucose, which means sugar enters your bloodstream more gradually. That smooths out the blood sugar curve and helps you avoid the sharp spikes that strain your pancreas. This dual approach, helping insulin work better while also slowing sugar entry, creates a strong foundation for better blood sugar balance. When used consistently, even in small daily doses like ginger tea or powdered ginger in food, it becomes a natural ally in supporting metabolic health without side effects. According to Science Direct, ginger supplementation in type 2 diabetic patients led to significant reductions in fasting blood glucose and HbA1c levels, thus showing strong potential for long-term blood sugar control. We know it's tempting to add it to everything from tea to smoothies, but if you're dealing with certain health issues, it may backfire. Its strong biological effects may trigger unwanted reactions in people with specific conditions. If you have any of the problems we've mentioned earlier, we strongly recommend you speak with a healthcare professional before including ginger in your routine. Your body isn't like everyone else's. How you react depends on how these compounds interact with your unique system. So take care of yourself and always be mindful of what works best for you. In this amazing video, we learned about all the health problems that we should avoid with ginger. But did you know that there are many ways to protect your health? Want to find out more? Watch 10 best ways to get rid of mucus buildup in the lungs. Or watch Avoid Almonds if you have these 5 health issues. Watch one, or even better, watch both. Do you know any other health issue when ginger might not be safe for us? Let us know in the comments below.